And let people slowly join us. Hello and welcome. We'll be starting shortly. We're going to let a few of our guests join us. Thank you so much for joining us today. We have a great panelists who are going to bring us through this talk. Let me make sure that my screen is sharing correctly. Okay, everyone. Hello and welcome to today's webinar for mental health professionals, mentoring women in the context of gender, racial, ethnic, and sexual power barriers. Thank you all for joining us today. I'd like to introduce myself very quickly. My name is Sasha Sicard, and I am the Education and Membership Manager here at ADAA. I would like to please note that this webinar is being recorded and will be available as an on-demand webinar within 24 hours of being live. So you are going to be able to access this. Before we get started, I would like to go over a few items so you know how to participate in today's webinar. You have joined today as a participant, and as such will be muted for the duration of the presentation. We've taken a screenshot you can see here of an example of the attendee interface. You should see something that looks like this on your own computer desktop. You'll have the opportunity to submit responses to the panel questions through the chat feature and submit text questions through the Q&A feature that you find in your attendee interface. You may send in your questions at any time. I would now like to introduce our wonderful panelists. Joining us today, we have Dr. Jessica Graham-Lopresti, who is co-founder of Bear Mental Health and Wellness, LLC, and an assistant professor of psychology and clinical psychology doctoral program at Suffolk University. Thank you for joining us today, Dr. Lopresti. We also have Dr. Sarah Hayes Skelton, an associate professor in the psychology department at the University of Massachusetts, Boston, where she is currently the director of clinical training for the clinical psychology doctoral program. I would also like to welcome Dr. Barbara Kemholtz, director of CBT training at Boston University Medical Center Psychiatric Residency Program, associate director of outpatient mental health services at VA Boston Healthcare Systems, and an associate professor of psychology at Boston University of Medicine. Thank you for joining us, Barbara. I would also like to introduce Dr. Karen Martinez, a child and adolescent psychiatrist in San Juan, Puerto Rico. She is an assistant professor at the University of Puerto Rico, where she directs the Center for Study of Treatment in Fear and Anxiety. And last but not least, thank you for joining us, Dr. Keith Renshaw, who is a professor and department chair of psychology, as well as the director of military, veterans, and family initiatives at George Mason University. We have a great panel today, and we thank you all for joining us. I would now provide a moment of silence while we let Dr. Kemholtz take over the screen share. Barbara, go ahead.
Thank you. Let's see if I can get this on the first shot. Look at that, 14 months and she can finally do it. So first of all, thank you, Sasha and ADAA for hosting this. And thank you all to my co-panelists for agreeing to be here and spend time with us today on this important topic. Sasha gave us lovely introductions, but I do want to give everybody an opportunity just to talk for a second about their own positionality, since we're going to be talking about gender, racial, ethnic, and sexual power barriers. I am, as Sasha mentioned, I'm Barbara Kemholtz. I am a straight, white, cisgender woman. My less privileged characteristics are largely invisible. I am an immigrant, and I am a religious minority. I am Jewish. But the lack of visibility on those characteristics is often really, is obviously very meaningful. Let me share now to Jessica Lopresti.
Hi, everyone. Jess Lopresti. I identify as Black, African-American, straight, cisgender woman. I also identify as a mother and a wife, and looking forward to sort of talking about all of these identities and dynamics as it relates to mentoring.
Thanks, Jess. Karen, do you want to go ahead?
Hi, everybody. I identify as Latina cisgender woman. I am a Puerto Rican and I live in Puerto Rico. And it's always interesting for me to talk about these topics since I live in an island where everyone is the same as me, but then when I have to interact with the United States, I'm a minority. So it's always interesting to consider all of these topics we're going to talk about today.
Thank you, Karen. Keith.
Sure. Hi, Keith Renshaw, and yeah, I identify as a white cisgendered straight male. I'm also identify as a father, a husband, and I'm living in the suburbs of Northern Virginia. Tenured professor, so when we talk about positionality and privilege, I'm keenly aware that I carry just about every level of privilege you can into these discussions, and I'm really humbled and honored to be included. Thank you.
Thanks for being here, Keith. And Sarah.
Hey everyone, thank you all for being here, and thanks Barbara for organizing this for us today. I'm Sarah Hayes-Skelton, and I identify as a white cisgendered queer woman who also is a parent of a lovely child who's in a two-mom family. And in terms of privilege, I think about a number of areas of privilege I have, particularly around my racial identity and positionality in terms of where I am in the academy. But I also think a lot about how social class is another area of identity that is embedded in all that we do and not often talked about. And I have a complicated positionality in that, the way that it changes across our field. So I want to hold on to that too as we talk today.
Thank you, Sarah. I feel like if my almost teenager were here, she'd insist I tell you I'm a mom too. Okay, so the way we're going to structure things today, I would like to start us off by having just sort of framing our conversation. Then we have a series of questions we're going to be addressing. And really during each question, we want to give audience members an opportunity to chime in with comments, questions, things that they would like to share. We have 90 minutes. We don't want you to have to sort of hold questions or hold everything until the very end. So we have nothing financial to disclose, although the conversations of these type tend to be fairly disclosing in other ways. So we'll start with that. And so, whenever any of us do this have this kind of conversation, I always do a little review of the headlines over the last 6-12 months. And I will say that on this particular issue, I struggled. I left the heading on this slide blank for days, and I kept coming back to it because I really didn't know how to caption it. And where I ended up was the times are changing-ish. We have had a long run of, this is not working. We have had a long run there we go, apologies, of equity issues, broadly speaking, around all sorts of individual diversity. And there was a while there, without trying to get too political, where the heading on this was really easy. It sort of was like, oh my God, help. And over time it's changed, but I think it's also still a very mixed bag. So we saw a number of years ago, in the face of the latest Me Too movement, anger, women of all backgrounds, of all representations, sort of standing in their anger, stopping to apologize for their anger. And it's been a bumpy ride in a lot of ways. I'm not going to comment on every single headline here, but you'll get sort of a sense of how various kinds of privilege have been intersecting with the Me Too movement, with feminism, with equity, with representation. This is one of my favorite, and I will pause on this, Men of the World, You Are Not the Weather. I always want to explain that briefly. There was this great article, I can't remember, it was October, a few years back now, right when the Harvey Weinstein scandal broke. This idea that for all of our lives, women, those who identify as women. And let me be clear, whenever I use the word women, I'm talking about any person who identifies as such. And I'll remind us of all that periodically. You know, all of our lives, women and those who identify as such, including those who identify as such, excuse me, are sort of taught, you know, this is what you need to be safe. This is what you do to be safe. You know, hold your keys this way, don't walk here, don't walk there, walk with this one, do this, do that. Much in the same way, you know, when you're sending someone out the door in the weather, make sure you've got your raincoat, make sure you've got a hat, make sure you've got your boots. And this notion of we, all those who identify as women, should not have to dress for the weather, should not have to prepare on an individual basis or on a group basis for that matter, for sort of facing all those who identify as men. And so I just really love that headline. And of course, the picture below is kind of priceless. We know that equity is a huge focus for a long time, certainly renewed again and again, particularly around not just gender, but also racial and sexual orientation and sexual identity, gender identity, excuse me. And yet we still know, these data are from the last year or two, young women aged 16 to 25 have saved less than young men of the same age. So it's starting early. This is 16 to 25. This isn't looking at, you know, 50-year-olds or 60-year-olds who have already had a career and dealt with wage inequity. There is something that happens early and consistently. We have seen a lot of really exciting candidates for political office, for other kinds of offices, which has, again, increased representation dramatically. But it's partly increased representation dramatically because we had so far to go, right? 1 + 1 is 2, that's 100% increase, and it's still lousy. This is not just in politics, this is not just in Hollywood. We certainly know in science, every woman I know in science, in academia, in professional settings or not, know who the Weinstein is. Every one of us knows who's the professor or supervisor or colleague that you don't go to have a conversation without your umbrella and your rain boots and all the rest. Similar, you know, again, just wanting to highlight, this is not just in Hollywood, this is not just in politics. And we have seen a lot of progress. And yet, just yesterday, I'm your doctor, so why are you calling me Miss? Just yesterday, I was in a meeting with about a dozen folks. Every single male was called doctor. I was called Barbara throughout. To be clear, I have no problem being called Barbara, but if I'm going to be called Barbara, you're going to be called Keith. Right. And if you're Dr. Renshaw, then I'm going to be Dr. Campholz. And of course, that's why Keith is here. Immediate thumbs up. But I think also really importantly, it's inadvertent. I participated in a large meeting about, I guess, 2 years ago, because it was before COVID, where the person who had set the agenda had written Dr. So-and-so for everyone who was a male, and just the name of everybody who identified as a woman. And I went over to the person and pointed it out, pretending I didn't know it was them who had written it, sort of asking them to let whoever had written this agenda know. And the person was genuinely apologetic, right? I do think we want to, I'm not making excuses, and I'm certainly not setting a stage for making excuses. But one of the things we will talk about today is implicit bias versus, you know, implicit bias, microaggressions, macroaggressions, and then just outright discrimination and racism and hate and misogyny. And that is a continuum, not making excuses for anybody, but it is an interesting thing to think about as you consider how to intervene on behalf of others. Of course, AAPI hate has gotten long overdue attention in recent months. This is an example also sort of across the contiguous US states, but also across other areas of the US in terms of leadership, Latina in this case, leadership. And so, of course, and this is why I had this moment or many moments of pause on how on earth do I title this slide, because here we see, Kamala Harris sworn in as the first female vice president. My daughter and I were literally jumping up and down in our house together when Vice President Harris was nominated, was added to the ticket, excuse me. We were all wrapped, all the people in my house, men, women, dogs, everybody was wrapped when she was sworn in. Very exciting moment, of course, when the recent presidential address, first time that two women, and even better yet, not two white women, but two women who represent additional diversity were sitting behind the president. And yet, there's now not a single Black woman in the Senate. And so again, that is really where I grappled with, what's the summary statement on the status? I don't know that I have a summary statement, but just to say that I'm tremendously grateful that the panelists are here to have this conversation, and that you in the audience have joined us to participate in it and think about it. So what are we going to do today? What are we not going to do today? We are not going to have an angry mob fun run. There is plenty of place for anger, and I want to be clear that is not dissuading people from having anger or sharing anger or standing intentionally in their anger, but only to say we're going to be focusing on other issues today. And that goes along with that. What are we going to do? We have a number of questions that we are going to be talking about today. I won't even say we're going to be addressing them. We certainly don't have all of those answers. But we are going to be talking about guidance for mentoring, especially in uncomfortable or sensitive situations, particularly if you as a supervisor and your supervisee do not share identity, do not share characteristics or positionality. We're going to be talking about how do you address harassment and other gender-based stressors. And our intention is for all of these conversations to be placed in intersectionality. How do you incorporate current events into ongoing supervision and mentorship? That's obviously been a particular issue in recent months, though really for many years now, and perhaps should have been always. What are some important supportive advocacy behaviors that you believe are important for your more privileged colleagues to be addressing? And behaviors is emphasized there for a reason. So this isn't like, what do you share on Facebook? This is, or Twitter or Snapchat or TikTok or all the things that are cooler than I am. This is, what do you do? What do you actually do, and what do people want to see their more privileged colleagues do to support less privileged colleagues, and certainly mentees and supervisees? And then how do you use your position or positions of privilege to support mentees and trainees experiencing gender and racial, ethnically based stressors, particularly when those are compounded by multiple intersectional factors? And how do you engage other privileged people in these efforts towards diversity, equity, and inclusion? So certainly we could talk about this for the next 6 months. We don't have that kind of time. But again, this is hopefully a conversation to start, and certainly not to end, and to add to the other conversations that are ongoing. So I'm going to decide whether to, one last comment before we go, excuse me. We do also want to acknowledge that these issues are complex, politically, professionally, economically, socially, and in other ways. We know that, it's common knowledge at this point, women and those who identify as women earn more than men. The standard the standard statistic that people rattle off is, oh, 70 cents to every male dollar, 80 cents to every male dollar. It's very important to notice that that's for white women. For women of color, and certainly men of color as well, those numbers are far more dire, with Hispanic or Latino women earning the least, I think it's actually a little bit under, I want to say it's 58 or 59 cents to every white male dollar. So again, just kind of keeping in mind, even the way we talk about inequity has this inequity baked into it. And to bring it back to academics, we see this in the leaky pipeline of women in academics. This does not break down the numbers by racial, ethnic, or other diversity characteristics, but we see, roughly 52% of assistant professors are women. By the time you get to full professors, you can see the steady decline. By the time you get to full professors, that number is exactly half. The most upsetting thing to me about these slides is that it was shared as an indicator of how well the institution was doing. I will not name the institution to protect the guilty. And I guess, again, it's like Kamala Harris is vice president. Now there are no Black women in the Senate. This is better than it used to be, and you can't be serious. So those things exist together. We want to emphasize, as we talk today, please keep in mind, to my mind, one of the most important, I don't know what descriptor to use. One of the most important qualities for me of my privilege is my ability to help other people along, to highlight, to emphasize, to amplify their voices, and to educate myself in ways that so that I can be as helpful as possible. And one of my favorite reminders that I always share whenever it's even remotely relevant is, if you've never been called a defiant, incorrigible, impossible woman, have faith. There is still time. So with that, I'm going to, and thank you for being here. I'm going to stop sharing so that we can all be bigger squares on your screens. Let's make sure this works. There we go. And with that, I am going to pass it along to Dr. Lopresti. I'm going to remind everybody of the question she's going to be starting to talk about, and then hand it over to her. Just how do you approach issues of mentorship that may be uncomfortable or sensitive from a perspective of gender, race, ethnicity, or other characteristics of diversity? And if you could, please include considerations for whether you're mentoring somebody who has the same identity and identifications as you, or different ones.
So yeah, I will start to talk a little bit about this very complicated question, and I'm looking forward to hearing my wonderful colleagues' input as well. When I think about sort of approaching mentorship, I really think about sort of how to set the stage for a mentorship relationship, whether it's sort of across difference, across similarities. Like, I have never had a mentee or a mentor where I shared all of their identities, or vice versa. And so, the first thing that I think is important to keep in mind are the ways in which our field was not set up for folks who are minoritized, right? Our field was sort of set up by white men, right? And so it's important to sort of understand, when we have folks who are coming into our programs or our clinical settings who are minoritized, that this is a field that's not set up for them, for the experiences that they've had. And so in that vein, we can't expect our mentees to sort of know all of the sort of ins and outs of and expectations of our field, right? We have to be sort of very direct about describing sort of what it is like in our clinical settings, what will be sort of expected of them, and also sort of have conversations around sort of their experiences in the field up until this moment. And so I think sort of setting the stage in that way, acknowledging that this field is not for us or by us, acknowledging sort of the minoritized experiences that women of color, you know, trans women of color, like all of the sort of intersecting identity, minoritized identities, like acknowledging that their experience in this field up until that moment and probably throughout their time and training is not going to be sort of like yours or like the field was set up. And so I think that's where we often go wrong is sort of assuming that our mentees who are minoritized understand sort of the unspoken expectations of our field, of our training programs, of our clinical settings. And that sort of sets the trajectory off sometimes in a really challenging way. You know, the other piece is, you know, I think communication style is often ignored as we're setting the stage for mentor-mentee relationships. And you know, I think it's ignored at a real sort of detriment to the development of our trainees at any stage. And so having an open conversation, I really try to do this about sort of how I communicate, what's important to me and of value to me around communication, and also hear from my mentees sort of like how they communicate, like what's of value to them, so that we can sort of come to a middle ground. So again, it's about sort of me meeting them where they are, as opposed to expecting my mentees to fully sort of transition into how I communicate and how I want to be in this relationship. And that's really about acknowledging the power dynamic as a mentor and sort of leaning forward or leaning towards the middle, as opposed to leaning back and expecting your mentee to come meet you where you are. And so those are just a few things that I think about, you know, as I think about approaching the mentor-mentee relationship. And I just want to sort of end with a little bit of a story. When I was in graduate school, I remember there was a moment where I was having a conversation with my mentor, and she sort of said to me, you know, Jess, I was socialized to think that I have important things to say in every conversation, right? I was taught that by family members. I was taught that by educational settings. I was taught that by the world. And she was like, and you weren't taught that, right? And so we need to find some sort of middle ground for you to be in this field, how you can be in this field. Like you can't do it like I do because of sort of the overwhelming racism and sexism and gendered racism in this world. And it's important to acknowledge that dynamic, right? I can't mentor you to be me. We can both acknowledge sort of how we're socialized and find a middle ground of sort of how you can find your voice in this field. So I'll stop there.
Do others have thoughts? Thank you, Jess. Yeah, that mentor of yours sounds pretty cool. Do others have thoughts or comments they'd like to add? And certainly for our audience members, I apologize for whoever I just cut off before you even started to speak. Please feel free to, I'm going to keep my eye on the chat. Please feel free to drop questions or comments in the chat. I'll keep an eye on those and I can read those as well. Sarah, I think you were about to jump in.
Yeah, no, I'm happy to help amplify some of Jess's brilliant words and add a couple of other perspectives. I think that what Jess said about understanding the differences in identity and how we're all, in some level, you typically have some different identities than our mentees. I think that I really just want to underscore that point of noticing differences, but also noticing similarities, and where that, for me, gets me into more trouble of making assumptions that I know the worldview of my mentees. So I struggle more with mentees who look like me, but have a different religious background or have a different socioeconomic background, in which case the mentee may have some privileges of being, say, white-skinned in academia, but not have that access privilege that Jess was talking about, not knowing how, so I think sometimes paying attention, that particularly for mentees from lower SES backgrounds or first-gen students, that a lot of that is particularly relevant, paying attention to their experience. And also paying attention to where our biases are. So for me, I noticed that some of my biases come up when working with mentees who may not have the same career family divide in terms of values that I have. And recognizing that particularly for some of the women we work at, the role of family or their role in family may be different, and that really shapes how they may want to approach the career and the field. And so really grounding my understanding in what in the mentee's specific values. And so for me, that is always sort of like Jess said from her wise mentor, who I also know quite well. So that is the inner joke that we're laughing at. That she is not trying to mentor Jess to be just like her, but to be her own self. And I think that is such wise wisdom. And that takes a really long time to help your mentees understand who they want to be in the field, because they may not see role models of who they want to be and the balance they want to be. They tend to see role models who are taking a particular kind of academic life, who's gotten them where they are to be the mentor in that role. And that is not all we're training, or who all I want to be training. So I'll stop there.
Other comments or additions?
I'll just a couple of thoughts. All that is terrific. I think really terrific advice and just terrific thing to keep in mind. I think, something that Jessica said that touched that off for me was, some of the, I think it was a podcast I was watching at some point with Robin DiAngelo, and she's written a lot, obviously too, but it was the way she said it in the podcast that struck me, where she was talking about how when she was with a friend of hers, a Black woman, who told her, you sort of, you talk over me, you interrupt me, and that's part of how your, whiteness comes into play and your racism. And she said, that's just me, I'm like that with everybody. She said, yeah, but when you're like that with me, that's where, and that comment, like, it was like a light bulb for me personally, because that's how I often am, I'm like, I'm just like that with everybody. I'm like, oh, but that's on me to like adjust that, right? Like, not on everybody else to just sort of accommodate that. So I think trying to sort of wrap our head around, right, how we're socialized, and that matters. And that if it doesn't match how someone else is socialized, that doesn't mean somebody else has to come match us, for crying out loud, right? It's so that's one really, really critical piece. The other piece that I'll just sort of mention is, I think a lot of time, I saw this even this year, we were working with I was teaching our introductory sort of therapy practicum with students, and they're seeing their clients for the first time. And we incorporate a lot of these writings on, how to address, primarily focused on sort of racial ethnic identity, not as much gender identity, but we sort of incorporated that in the discussion. And so much of it is oriented about how do you approach, even the writing on that is primarily written for white students working with clients of color, right? And it's like, well, because the composition of our student group happened to be, we only had one white student, and the rest were, folks of color. And so we had some really interesting conversations about, like, yeah, but like, how do I, what about me, right? Like I'm in the therapist position, but societally, I'm in sort of the one down here. How do I broach that with my client, right? And bring that up. And it was a really interesting piece to me. We had to sort of look for additional things, because so much of it is geared in the other direction, that even as the writing, and our teaching tries to take this into account, again, as was being said, there's, I think, Barbara, you mentioned this, right? There's inequity based, built into the way we try to deal with the inequity, right? And so I just think those are some critical pieces to think about as you're working with students.
Well, and I think, to circle back to what Jess was saying, I agree with everything that's been said, but that idea, Keith, of, that's how I am with everybody. Well, because you were taught that what you have to say is important or clever or funny, right? And I'm in the same position, right? I'm similarly, right? I have that same privilege, and I think that same way of being. And it is an appropriate and effortful experience for me to have a thought, to have a comment in a setting like this, or in other settings, and think, you know what? the world will keep turning if no one hears that remark. Like I do, like I just don't, it's just not that important. Like just, and that's a different experience. That's a different and I think important experience. We are getting some questions in the Q&A, and I'm trying to be a good timekeeper, which is like leaving me in charge of the French fries, which is not a good idea either. But but I will give everyone a chance to comment more on this, and then I want to shift to a question from our audience. Does anybody else have comments to make here they want to add? Okay. So one question, if possible, can you speak to the sandwich generation of clinicians who are supervising trainees, but also dealing with those who have more power? How do we foster positive mentorship within toxic workplace environments? How do we determine how much to disclose or shelter our trainees from a problematic system? That's a great question. Who would like to start with that?
I can chime in, but this is so complex, and I certainly don't have the answer. I feel like I would own the world if I knew the answer to this question. One of the things that I think is really important, particularly around mentorship of folks who are minoritized or marginalized, is that we cannot shelter them, our mentees, from the world. Right. And honestly, like as a mentee and now a mentor, I was never looking for that shelter. Right. Like that is sort of the life that I have lived. Right. So I think that's a setup and sort of like trying to figure out how we can protect or shelter our mentees from that world. I think there's a difference between sort of sheltering our mentees from that world and stepping up when that world arises. And I think that difference is really important. I hope as a mentor, and I know certainly, my mentors along the way have often really stepped up in those situations when the world arose the way it did, when gendered racism sort of entered the room or entered the space. And that really sort of spoke volumes. And I think as it relates to the power dynamic, that stepping up can mean a lot of different things, right? You might sort of bring attention to something in a public space, and in a private space with your mentee, acknowledge that it's happening, acknowledge sort of the pain around it, support your mentee in living within the system, right? And so there are different ways to do this in different spaces is what I'm saying. And I think the resounding message here is when you do nothing, that is sort of the loudest invalidation. And so something is better than nothing. And I'll stop there.
Yeah, and in terms of like that sandwich generation, I would also say that everyone has some power in the position they're at. And I think it's important for everyone to address what power they have. So if you are a postdoc, then you have a little more power than a graduate student. If you're a graduate student, you have a little more power than an undergraduate student. And then you need to choose to use that power wisely as much as you can, and to amplify those people who are not in that position of power. So I think that if you want to be able or feel that you're doing something, you always can. There's always a way if you feel comfortable with doing it, because also you don't have to be a hero or you don't have to step up every single time. So it's just a matter of figuring out what you want to do to make a difference in the workplace, what you feel comfortable doing, and understanding that you do have power to do it.
And I think also the sort of speaking of the differences and sort of different levels of power and different levels of privilege, I think that it's also helpful to help the mentee, whatever position you're in, whoever you're trying to assist or amplify, rather than sort of giving them a list of things to do or how to handle it. First of all, helping them think about obviously what they want to do and what matters to them and what their values are driving them to do, which may be similar, overlapping, or very different. But also, in some ways, rather than making recommendations, which I think can be, I don't know, condescending is the only word I can come up with. And particularly if you have the privilege like I do of being white, then like it feels out of place as well. But to help brainstorm options and help them think through the potential outcomes of those different choices, recognizing really importantly that the outcomes are going to be different depending on who the person is, depending on who the person is saying, who's talking about it, who's going to take this action. One of the, in my little privileged nook, one of the things that I often have this conversation with my father, who is a white male physician. He's now retired. But I remember this one conversation, I was probably in my 30s, and I was complaining in a benign sort of whiny way that I had this, 7:30 a.m. meeting, and I was like really unhappy about that. And he said very seriously, well, I just tell people if they're going to have a meeting that hour, they have to bring food. And if there's not going to be food, I'm not going to be there. I was like, I'm sure that worked for you. And yet, if you can imagine, what, even if I would have been 35 at the time, which I don't think I was, a 35-year-old white woman with a PhD saying that, let alone, a woman of color, let alone, you can imagine how dramatically differently that plays. And so just sort of thinking about how to help people think through what the possible repercussions are or outcomes are, and how those outcomes would be different or could be different or likely would be different based on who they are and what position they are in the system, both in terms of seniority and age. I found to be a big thing as well. So I think that's another piece to add.
I just want to jump in because I think this is such a really important question. And I just really feel for all of you out there in the sandwich generation, because it's so hard. And I feel like we've been answering about how you work with a mentee, but I think you can only work with a mentee if you're also doing the things you need to be doing to care for yourself. And so I just want to highlight that, like, as we step into more and more roles and we're finding ourselves kind of really sandwiched, just to make sure that we're still accessing our support networks, like the people that we can be venting to and commiserating with, who can help hold us so that we can hold the trainee in the midst of all of that. And it's easy to get lost kind of in the shuffle, where we can become more and more focused on how do we take care of the trainee. And for me, it's so essential that I'm also attending, that I have a place that I can cry, that I can be mad, that is not with the mentee that I'm working with, so that I can help them navigate. The other thing that we've been doing in my circles lately that I have found really helpful is just explicitly calling how hard it is to be fighting against the system that we're embedded in. And just using that language with mentees, with training, that's what we're doing. We are both living in a problematic system that we are trying to fight against, but we're still living in it. And so that there's always this tension, and there's no way around it.
Thank you all. I do see another question. I'm not going to go to it yet because I think we're going to cover it substantially as we go along, but I'll do my best to come back to it if we don't. So our next question for discussion: how do you address this one? Karen is going to lead us on, start off on this for us. How do you address harassment and other stressors based on gender, race, ethnicity, and other characteristics? This can include what do we do? What do we do? How do we help trainees? How do we help others? So how do we support trainees? And what do you do also that goes further than just sort of validation and support? What really concrete actions and problem solving actions can you take? Thanks, Karen.
Yes. So I think, we've talked a little bit about concrete things that we can do to address harassment and just any type of bias and prejudice. But I do want to point out that if we really want to do something, we need to start with ourselves. we all have bias. We all have prejudice. As a Latino woman, even though I fight against it, I was brought up in a very Catholic environment where women are supposed to be sacrificed and put everyone else first. And that's my cultural environment. I cannot move out of that. So I'm continuously checking my bias. I'm continuously checking, why did I think that? Why did I say that? And that just coming from me and being that model for others is also something that's going to help to change the environment. So I will, the first thing, everyone who's here and attending this webinar, that's the first step, because you're obviously thinking about this and thinking what we can do to make it difference. And the other thing is that there is always something that if you feel comfortable doing, you can do. I know we're very, we're very tired of the structures that we have in place to help us with everything that's going on. We're very tired with diversity, inclusion, and equity committees. And we're very tired with, the ways that we report harassment, and everything is so bureaucratic and takes time. So it's like, how do we change that? We're so tired of it. We need to take a stand. We need to participate in the committees. And I hate saying that coming from an academic standpoint, nobody wants to participate in more committees. But, we need to be there and be the voice of where we're doing that. And we have to choose where we're gonna do it from. So, depending on the position of power where you're at, if you're more advanced, if you're less advanced, there's a lot that everyone can do to make sure that these topics are being addressed in a way that gives us some concrete mechanisms that we can deal with harassment in the workplace. So we need to understand the mechanisms that are set up in our institutions. We need to understand what do you need to do, and how then can I support the environment where I'm at, my immediate group, in order to fit into what the institution is saying and what needs to be done differently, and then how can I work towards that. And the other part that I think it's so important, and that for women it comes naturally to us, it's that we need to amplify each other. And how can we serve, even with our peers, just be very conscious of not overly criticizing when it's not needed. Be overly conscious about saying you did such a great job, you're so great. Just, like sometimes just putting out there, like a group email message. Did everyone hear about this incredible thing this person did? Because for women, it's so hard for us sometimes to applaud ourselves and to, make people know what we have done. So maybe that is something that we can do, and that will help us all grow. And then, hopefully we won't have these issues going on in the workplace. And the other thing that we can do, even if we're not in a position of power, is to identify microaggressions and call them out. Call out people who are doing inappropriate jokes, who are just saying, oh, I was just trying to be funny, or, I didn't mean anything. No, that is an aggression. I cannot tell you how many times I have been asked about where did I learn English if I'm a Puerto Rican. And, and it's something that it's just, I don't even know how to answer that anymore after all this time. So, sometimes we have curious questions about others when they are different, but think, do you really need to ask that question? Or is it something you can search for yourself and maybe find out, and not put the person in the position of being said, why am I being asked this for the 1,000th time again? So there's a lot we can do. And depending on the position you're at, it will depend on what you feel comfortable about doing. But if we all decide to do something, that then as a group, we will change the environment and we would change the culture.
I want to make sure others have a chance to add to that.
Thank you, Karen. Yes, all of those things. And, one of the things that I'll add is this is really about systemic change. I think that oftentimes when we're thinking about sort of addressing harassment, addressing bias, addressing racism, and oppression, we're sort of thinking about it on an individualized basis. And I think that's really problematic because it can't be on just one individual to sort of push this envelope. So we really need to look at the systems in the context of our departments, in the context of our broader institutions, the grievance processes, and understand sort of the ways in which they are anonymous or not anonymous. We need to have accountability measures in place. I can't tell you how often I've been told in the many systems I've worked, well, so-and-so is just like that. We've all sort of decided that it's okay. They'll retire soon, or, everyone has experienced this, as if that would make me feel better, that everyone has had these experiences. And so, I think we need to sort of step up around sort of the accountability and have some systemic approaches to hold people accountable. So if someone is behaving inappropriately in a number of ways, is engaging in racist or gendered heterosexism, any of the sort of areas of oppression, what are the steps that departments, that institutions can take to hold people accountable to change, right? It's people make mistakes. I've made mistakes. I'm not trying to sort of, get people sort of fired and ruined. What I'm thinking though is if we have sort of accountability measures, then we're giving people the tools to make the changes that they need to make. A lot of people aren't aware that their behavior is inappropriate. A lot of people are aware and don't have the skills to change it. And then there's certainly a cadre of people who are aware and don't care. And those are the folks who, we might take some stronger measures, but there are a lot of people who are sort of I want to change. I want to be different. I just don't have the tools to sort of make these shifts and changes. And I need help around that. So.
One of the things that I've experienced, so, I'm sort of, I guess, mid to a little beyond mid-career now. And one of the things that I have utilized when I've wanted to make a change, whether it was sort of a gender-based, a sort of strictly gender-based, I don't even know what that would be, but, or a more intersectional challenge that I've seen, is to look for allies who are fully privileged, right? The Keiths of the world, right? The full professor, the full professor, tenured white guy, straight, right? The whole shebang. And jokes aside, it is why, it's part of why we want Keith in this conversation, right? Because systemic individual change, but also really importantly, in my opinion, systemic change happens more easily and more quickly or readily when you can kind of harness the energy of those folks, right? And how do they, how do those folks, the most privileged among us, sort of direct their energy? And we see that, in Hollywood, when a specific, when some megastar gets an illness, whoever's funding research on that illness is yes, because now there's going to be help, right? Sort of that kind of an idea. My experience has been harnessing that, really engaging with those folks. In some cases, I'm those folks, right? I might be the most privileged in a specific situation. Usually there's somebody more privileged than me because I'm still a girl. What are others' experiences with trying to engage those who have the most power, the most privilege, however we want to think about it, in making these changes?
Well, I would just say that you need to choose wisely because not everyone is going to be an ally. So you need to be on the lookout, who are the people who you see that are speaking out, who are pointing out microaggressions, who are amplifying others who are not like them. And then, reach out, because if not, it could be a traumatic experience trying to make someone an ally who really does not want to be. So that's the only caveat I would put out there.
The last thing I'll add before we shift to the next question is, I think also someone else already said this, and I apologize that I'm not remembering who it was. I think it might have been Jess. You can make small changes. You can do small things. And so one of the things, one example we have in the system where I work is that we added a question to our interviews, right? It occurred to us, I mean, only 30 years later than it should have, but it finally occurred to us that when we were interviewing, we didn't have any question on our like staff faculty interview in any way that addressed diversity, equity, and inclusion, even a whiff. And, you know, I was and remain embarrassed by that because it was like 6 months ago, maybe a year ago, that we changed this. But even that, right, it's a seemingly very small thing. What I feel good about, clearly not the timeline, but what I do feel good about is not only the message it sends people who are applying for jobs who are part of one of those, who have one of the characteristics that we want to be, I'm stumbling on my words because I'm afraid to screw this up. Someone give me the words. Not only does that send a message to our diverse candidates and applicants, which I think is very important, I would argue even equally importantly, it's sending a message to our not diverse, to our very privileged applicants that this matters here. And if you want to be here, great, but you're going to need this to matter to you too, or at least fake it. So our next question, Sarah's going to start us off on an answer. How or do you incorporate current events? For example, the seemingly endless examples of gender inequity, sexual harassment, racially motivated violence, movements like Black Lives Matter and other anti-racism activism or other social justice activism into ongoing supervision and mentorship?
I think the quick answer to that is yes, I definitely include current events. I think for me, I don't know how not to. And I think one of the things that I've learned over the years is that if I'm not the one that brings it up, people don't always know that this is a safe space to bring it up, or knows that, kind of getting back to what Jess said in the beginning about what the academic rules are. I think there's a lot of assumptions about what are the academic rules about what can be talked about in a mentoring relationship, and what are the rules about that it should only be about research. And so, just for example, and so I think there's a lot that I do intentionally to make it clear that I am mentoring a full person, and that means understanding them in context of life. I also think that, I mean, particularly this past year, there is a lot of, shall we say, national events that can't not be on my face, you know, and so there is also no way for me to be authentic if I am not at least allowed to be somewhat of a human. And I say somewhat because I'm not, like, I do have different boundaries in my mentoring relationships than I do in others, you know, so I'm not saying that there aren't boundaries there, but that there's a piece of it being authentic. And so for me, all of this comes back to sort of where Jess started us out, is really how do we see the mentee as a whole person? And how do we give ourselves the time and space to create that? So for me, that means that I chat with my mentees, that I try to break out of that white cisgender male vision that all we have to do is the work and that our goal is being productive. And I very intentionally cultivate it not being that. That actually is a shout out to one of my grad school classmates who told me that my first year of grad school. You have to talk to your mentor, like ask her personal questions. That will work better in this relationship. And it was life-changing for me. So that's part of the answer to that. People thinking about becoming mentees. But that also allows you to get a better bead on what is coming up for the client, and making some assumptions about what movements, what issues will be most relevant to them. I think this is particularly true, I think, wearing sort of my sexual gender minority hat in this space, because those are not visible identities. And there are also identities that sometimes change. I mentor primarily grad students, so I'm mentoring people predominantly like 28 to 30, which are often a time period where people's gender and sexual orientation the people are coming out in different ways. They're expressing their gender and sexual orientation in different ways. So it's pretty common that it is within my mentoring relationship that I'm learning that people are switching pronouns, and helping them navigate what that looks like in the space. And if I don't have time to get to know the whole person, then I'm just continuing to hit microaggressions or may not know which of the current events to bring up, bringing it back to the question. And so by truly knowing the mentee as best as I can as a person, it allows me to make hypotheses on which current events may be relevant to them. And I say hypotheses because it's really important to hold that loosely and to not assume, and also not to assume that it is something that people want to talk about. So like this came up a lot around the Chauvin trial lately, where some mentees really wanted to talk about it. And some mentees were like, I'm intentionally not watching the news. Really what I need in this meeting is for this to be distracting and for us only to talk about my master's thesis and nothing else, you know? And so developing the relationship with the mentees that allows them agency so that they know that they have some agency that I will ask. I often ask things like, there is a lot going on in the news this week. How is that coming up for you? Is that something you would like to talk about right now? And for me, it's important to be doing that from the beginning of the relationship so that it's not just when, like, so that it doesn't seem like I'm picking and choosing one particular issue, but making it something so that they know. And now a lot of my mentees will come in saying, can we just talk about this briefly? Or I know we were supposed to talk about this, but can we actually talk about whatever's going on in the news? Or frankly, sometimes the opposite, which I get emails before a meeting that's like, can you help me keep on task today? I need the distraction. You know, and so allowing there to be space for both of those is really important. I know, Barbara, one of your sub questions for this was, how do I balance boundaries and authentic relationships? And I think that's really important and tricky. And I do not think I have the answer on this. So I will share what I do. And I'm also happy to share some of the pitfalls of what I do. And you know, I think this is something that evolves for me over time. I start by being pretty open about who I am. You know, so I try to do like versions of an addressing framework and understand people's complex identities. I share pieces of my developmental background, including kind of growing up in a lower middle class family and not knowing like how I was going to negotiate finances in grad school. And like, you know, so I'm quite open with my own experiences, although they're the experiences that are relevant often to like the work we are doing, but it's still, I would say, experience does a lot of self-disclosure. Thinking about mentoring women, and particularly sexual and gender minority women, I'm really, really upfront that my family is in the room. So everyone I work with like meets my wife, they meet my child, they know detail, you know, like, and that is intentional because I think it's an important modeling perspective. And I think it also models that I value family and life, or life broadly. I share hobbies, you know, like, and so that I don't look like someone who is just focused on productivity, because that is so what people are socialized to come in and talk about. By sharing a lot of who I am, it allows me to seem like I'm sharing more than I think I may be, which allows me to, I think, be authentic without feeling like I am sharing things that would feel like boundary crossings. So even the people who I think are incredibly close to me, there are things that they would not know, like within like some of my like own personal pieces. So I think kind of related to that question we asked from the Q&A, I think it's important that I have places that I go and I cry. Like I have a really good colleague, some people on this panel may know, who like we will call each other before we go into a mentoring meeting to cry, you know, to get it out so that, well, that doesn't mean I'm not talking about whatever the crisis, like horrible, painful thing is that's happening, but that I can do it focused on the mentee and not focused on my own processing. And I think that balance is really tricky. And I definitely slip at times. But that is my aim. but I'm curious what other people have to say.
What do other folks have to add to that? Thanks, Sarah.
Yeah, I really appreciate Sarah, that comment about being more open about yourself. Since I'm a psychiatrist and med school is very against that, you know, physicians, we are supposed to be these very, you know, non-personal people who don't interact with each other. And then you're supposed to come into psychiatry and help your patients open up. It makes no sense. You know, how do we fit that in? So thinking about with my psychiatry residents and even with my psychology students who rotate here at the Department of Psychiatry, I think that would be very helpful for them to be able to see someone who, you know, is already, you know, the mentor and the supervisor to open up and start these conversations. I think that's such a powerful statement that we can do.
Other thoughts or comments?
I mean, I think that's fantastic. I sort of take a similar approach, I think, with trying to be, and again, I think it's the more privilege you have, the easier it is, but I think the more important it is then, right? You know, so I mean, my students know more about my struggles with parenthood probably than they should, but you know, but they know that it's a struggle, right? You know, and that I think it's an important struggle, and that I'm not always good at it, right? You know, so, but like I do that a lot, you know, like I very intentionally talk about when if I can't make a meeting because of something related to childcare, I'm very vocal about it, not because I want prizes for actually being involved, but because I want to show like, hey, this is okay, right? You know, like if you got something going on that's life, like let's just work around that, right? So I think that's huge, and I think, you know, in some ways it circles back to Barbara, you made this point earlier, and it goes to that question that you said we're going to address as we go, you know, for the folks who are like, you know, talking about like, how do you do this when you're in a position of lower power? It's a lot of it is finding people who have that privilege, that power, right? You know, who you can trust. I think it was, you know, Karen, there was somebody pointed that out too, right? It's like, you know, like test it carefully first. But find your allies, find your support networks. And hopefully then they can help think through how to push on things, right? You know, and what to push on, what not, you know, talk to those outcomes. But that boundary piece, I'll often talk when I do have, you know, small example, but like Facebook friends, you know, like I've had students who will do that, and I see, you know, like I actually won't be Facebook friends with you until you graduate. I said, I'm, you know, if we graduate, absolutely. And then I explain why, you know, I'm like, you know, like, I don't want you to put something on there and be like, oh my God, right, you know, and I also don't want to put something on there and have you be like, what? So, you know, but so I'll have the discussion about the boundary and the why explicitly so that people sort of get it. So.
Well, I think again, one of the reasons why I invite, you know, why we welcome Keith on this panel and why I think he's such an important voice in general is, you know, one of my favorite things that I see professionally is Keith's signature block. And at the end of the signature block, and I won't be able to quote it exactly, but it says something like, you know, I'm going to send you emails in the middle of the night. That works for my work-life balance, but don't feel like you've got to respond in the middle of the night because it might not work for yours. I'm obviously paraphrasing, but that's the gist, which I love. And I think just to add, you know, there's so many different layers. It feels like they're layers and layers. And I feel like with age, perhaps obviously my views have really evolved. I've sat in a meeting where I saw a young woman reference having a childcare conflict. And it was a meeting that was headed by two, I will just say, very traditional men. I will leave it at that. They were very senior and very traditional. And she referenced a childcare conflict. And a colleague of mine, this woman's mentor, my peer, after the meeting scolded her harshly and said, essentially, I'm quoting now, you can never do that again. Like you can never mention like children or your life ever again in those meetings. And this was about probably 15 years ago now. And all the women involved were white. Frankly, I think all the people involved were white. I'm pretty sure everyone in the room was white. And at the time, I thought, yeah, you can never say that again. And I'm horrified at former me, right? Like I'm really horrified. There are a lot of stories that end with I'm horrified with former me, but I'm horrified with former me. And to your comment, Sarah, about like, do you cry? And you pre-cry so you don't cry with your mentees. I fully respect that. I'm not challenging that in any way, but I also think there is this piece, like, and crying is, I think, a really potentially important one, right? You don't cry at work because men don't cry at work, right? I read a book on like being a woman leader, and like this is also 15, 20 years ago, first page of the book was like, rule number one of being a woman leader, you can, and literally it said, you can never, ever, 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 there were like 20 evers, like lose your cool at work. And I was like, yes, I can never lose my cool at work. And so I think obviously, Sarah, the point you're making, I think, correct me if I'm wrong, is you want the supervision and the mentorship session to be focused on your mentee, not on you and your emotion and your tears, of course. And I think it's a really interesting question of like, when is it okay to cry at work, right? Like, when is it this incredibly insidious gendered thing to suggest you can't tear up at work or show emotion at work? And I don't want to belabor this point. I find it a fascinating one, in part because I was in a meeting 2 years ago, maybe. I will never forget this meeting. I was in a meeting 2 years ago where I had a verbal conflict with a white man who, all the members of the 4-person meeting, everyone was senior to me. Everyone was white, 2 men, 2 women. One of the senior men, we had a verbal disagreement. No voices were raised at first. And then towards the end of our disagreement, he not only raised his voice, he stood up and walked out of the meeting. He literally turned to me and said, I won't do this with you. And he walked out of the room. I was very clearly angry in the meeting. I was very clearly showing emotion in the meeting. I wasn't shouting. I happened to not be crying. I certainly wasn't throwing objects, nor did I walk out of the room. The report from the other senior male that went back to colleagues who he was stupid enough to tell was that Barbara was very emotional in the meeting. And 15 year ago me would have said, no, I wasn't emotional. I was really calm. It was the other person who walked out. And 2 year ago me said, damn right, I was emotional in the meeting. I was pissed. So I've already belabored it. I don't want to belabor it further, but I do think there are these interesting questions of like emotion and boundaries, and there's certainly cultural pieces there and age pieces there. And I just think it's so complex now in a way that, at least for me, felt very simple years ago. You don't cry, you don't show emotion. I don't know.
Yeah, no, I agree with that. I'm definitely talking about the working it out so that it's not like, so, and plenty of my mentees have seen me cry. I'm not opposed to having emotion with them. Or also, to your other point, sharing some of the struggles. Like, I think it's also really important for me not to pretend like my life is easy, because then that can be invalidating to their struggles. So I do share, like, particularly if they've witnessed it, I don't always share things that aren't like, right, like there's a piece that they don't share, but I'm not hiding how hard things are for me.
Yeah.
When they come up.
Yeah. And certainly I just want to reiterate, I was not critiquing you on that, Sarah. I just wanted to go ahead, Jess.
I just wanted to add one quick thing that I personally have been learning about and struggling with over COVID is sort of like my professional life entering my home. Y'all can see part of my house now, and having a 6-month-old and a 3-year-old, and like what that means about sort of like being in meetings for, my academic position or my businesses, and just feeling a lot of shame about at the beginning about having my like naked 3-year-old running around in my house, or, looking a little disheveled, or having a childcare conflict where I had to have a kid in a meeting that I didn't anticipate. And I just wanted to express that challenge, particularly for parents, particularly for women who are parents, women of color who are parents. Like, there is this pressure to be like over professional, right? Because like, particularly as a woman of color, there's a lot of sort of socialization that like women of color are not professional, that we are not intelligent, et cetera, et cetera. So like, I've been sort of steeped in this world of having to try to be sort of overly professional. And so COVID really sort of challenged me in that way. I've decided over time that, I'm really excited about this new time where I can have my kids in meetings, and where I will continue to have my kids in meetings even when COVID is over, so that I don't have to feel so burdened about sort of how I need to be in these spaces, and having folks who have been parents for longer than I am modeling that has been like truly crucially important. Like, I've known Cora since she was in Sarah's belly, like there were always conversations about kids. Like, Karen always talks to, Barbara, you always talk about your daughter. Like, these things I think are really important to be modeled by senior women in the field. I think that's how we change the system of sort of expecting, parents and mothers in particular not to, be mothers in contexts outside of the house. So I'll stop there.
Well, it's also worth noting, and this can't be overstated, that there's no meeting that a naked 3-year-old does not improve. I mean, come on.
I couldn't agree with you more, honestly.
Come on. I'm mindful of our time, so I do want to shift us to our next question. What are some of the important supportive advocacy behaviors that you want to see from your more privileged colleagues?
So, I think we've really talked about these throughout, the webinar, but I would say speak up, when you see something, when you see someone being harassed, when you see someone who is being treated unfairly because of their race, their gender, because of any characteristic, speak up for that person. You might have that power to speak up that person does not have. And again, amplify people as much as you can, any way you can. Just bring everyone up with you. That's, I think, the best you can do.
Other additions to those thoughts? Thank you, Karen.
So and Barbara, I can actually kind of weave this together, I think, a little bit for the next question too, because I have a bunch of things that occurred to me, but they sort of dovetail. Again, being somebody, I think, with a lot of different aspects of my identity that give me privilege. I think a lot about this and about how I can use that, right, to sort of promote things. And I think there are a host of things, and it's really interesting because one of the things that I have to work on a lot, and I'm still working on, as evidenced by I'm talking right now, is I was just in a thing yesterday where a fantastic faculty member in our College of Education, Megan Call Cummings, started out, and she said, think about when you want to step up and step back, right? And that's one piece already, where it's like, well, wait, when do I need to hold back, actually, right? And not insert myself thinking I have so much important stuff. Another is to really try to put sort of issues around gender, around sex, around race, around ethnicity front and center. And how do you do that? I think, as Karen pointed out, where you call things out, right, when you see them. In meetings, I try to put them actively. So one of the things I've done as department chair is take our DEI committee, to Karen's point, and not only sort of try to recharge that, but we've given them kind of like a special spot on the agenda, and we've given them some extra resources, so that every meeting there's like a thing we're doing and whatnot, and and so we've tried to find ways to sort of up that. Another thing that we've done is kind of put that on the table as a discussion of like, how does this fit into our department values, right? And I'm not going to lie, like there's a little bit of a slant to that, right? Because it's like, you know, it's that's a hard one to argue against, but let's have the explicit discussion, right? And everybody's on board with this, right? And now this is an institutionalized value that when we come back to major decisions, right? I try to run a very sort of value-based, right, you know, decision model, right? You know, well, now that's like, well, how does this impact our DEI? You know, because that is front and center. We've all agreed that's a massive, important value. So really thinking about those types of sort of broader things, but then also really not neglecting the idea of policy stuff and community stuff is like, ugh, right? But that's where stuff gets done, right? So like, you know, Barbara, you mentioned this idea of the questions that you ask in the interviews, right? I mean, that's like, oh, whatever, right? But actually, that has a real tangible impact, right? You know, how do you form search committees? What do you ask search committees to do? That has a major impact on how things play out. So thinking about how you can actually find policy points where you can institutionalize these things, I think is critical as well. I've got a couple others, but I'll pause there because I will step back.
I'm going to actually jump on that just because my middle-aged brain will forget it. The other thing that we did that again, 30 years too late, and it's only 30 years because like that's how long I've been a professional. It's more too late than that. But one of the other things we did that I'm really pleased with and proud of is, you know, when new employees come on now, particularly our, you know, more diverse new employees, we make sure right away that they know about all the resources available to them. They know about all the diversity, you know, committees, all the just all the activities that we quietly, really too quietly engage in because I think a lot of people didn't know about them. And some of those are new, but a lot of them are not. And a lot of them are things that I'm sure over the years people would have liked to avail themselves of, and they didn't know about them. So yeah, little things can, I hope, have a big effect.
One of the things, Keith, I was thinking about, well, I was thinking you sound like an awesome chair, but aside from that, like another thing that I was thinking about as you were talking is how oftentimes sort of, you know, addressing inclusion, equity, and justice sort of within our institutions are sort of relegated to a committee, or in some ways relegated to the folks who are minoritized within, you know, those spaces. And I'm naming this, and I don't know how to sort of shift it, but I'm naming this as a real challenge within departments and institutions. Like, how do we infuse it? Like, how do we ensure that everyone is on board and engaging in the actual work? Because I think that's really how it gets done. And I think there's something about being a chair and sort of centering those things that is really important. It sort of suggests like, hey, if you want to be a part of this community, if you want sort of my support as chair, then you need to be on board here. Like, you need to do your work and not just sort of relegate it to the folks who are minoritized to teach you or show you or change your syllabus or X, Y, and Z. And so like, I think that's a really important piece around action is like, how do we, like I always say, like, you know, if it were up to people who are minoritized, these changes would already be made, right? Like, we are not sort of, we didn't develop these systems. We're not maintaining these systems. And so like, you know, I say this to my white husband all the time, like, you need to be having these conversations, you know, when I'm not around, because like people are going to say things there that they're not going to say when I'm in the room. And so I think that is really true for all of the systems in which we're working, is sort of how do we get the folks who are like on the periphery to sort of say, hey, y'all need to be involved in this as well.
That's such a good point. And I'll just echo, you know, we actually struggled with the committee piece already, right? Because we were like, well, we don't want it to just be a committee, right? But then we're like, but we got to get the stuff done, right? You know, but that's how we, so, you know, so we try to embed it within the department. So I think that's a piece. But like you commented too, I think finding ways to embed this into evaluation frameworks is another, like, you know, wonky, boring policy, but super important, because now it's like, actually part of your review is tied to this. What have you done lately? What did you do this year? Yeah, anyway.
Oh my gosh, yes, yes.
Just to echo that, I want to pause to make sure no one else has a remark they want to add first. You know, I think there are so many ways. You know, I personally get frustrated when I see really well-intentioned, smart, capable people, like dismissing white guys and deciding like they shouldn't have a seat at the table in any of these conversations, and for a bunch of reasons. First of all, like, how is that any more fair than dismissing women and, you know, whatever. But also from a practical perspective, like, I think to your point, Jess, like, people will say things when the other is not in the room, whoever that other is in the case. And I think so my husband, who is also a white man, he's in biotech. So, I mean, first of all, like, almost everybody's white, or certainly, I'll put it this way, nobody's Black. And, you know, obviously that's a gross exaggeration, but it's a minority, it's a very overwhelmingly white group, and it's also overwhelmingly male. And so he has done things like, you know, make sure that on the board of his company, there are equal numbers of men and women. He, you know, when obnoxious, condescending conversations happen, and the man who made the comment turns to the one or two women in the room and says, "Oh, sorry, no offense," my husband will say, "You need to apologize to me. That offended me." And sort of these ways in which when we, whoever the we is, whoever is the other in the situation, aren't in the room, for our allies and our colleagues and our, you know, trusted others to carry that and to internalize that. Because I feel like in so many ways, I mean, I'll step down off my soapbox. I just feel like in so many ways it is everybody's, it is those folks' job, right? Like, Black people can't solve racism, like women can't solve sexism, you know, all of these pieces. And it really resonates with me, but I'll stop there. I recognize there is one more question in the chat. I feel like we've answered it. If whoever posed that question would like to follow up with additional questions, please pop it in the chat there. I do want to shift over, just in the interest of time. Our last question, Keith already started us out on: how do you use your positions of privilege to support mentees and trainees experiencing gender, racial, ethnically based stressors, particularly when they're compounded by multiple intersectional factors? And how do you engage others in diversity, equity, inclusion efforts? I will just say quickly, because I think everything else has already been said really importantly, and I appreciate that. The word that keeps coming up in this conversation that is my go-to is amplify. I think the word amplify in this context came from the Obama White House, where there were a lot of women in the Obama White House, certainly the first term and the second, but during the first term, lots of women in the Obama White House, not a lot of airtime. And they basically hatched a plan to very intentionally amplify each other. And it worked. And so, you know, being not very creative myself, I've taken that page and tried to use it as much as possible. I think the other thing is to, I think Sarah said it, maybe Karen as well, to name it. When I see something, to name it. When I see a young woman being called really pushy, to name that, to ask the question aloud. I wonder, would we be saying this? Like, I also experience her as pushy. Would we be saying this if she were a man? I also experience her in this way. Would we be saying this? I don't usually make a lot of friends that way. But, you know, I'm old and tired and I don't really care anymore. The other thing is, and others have said this, I think in this context in our discussion today, but elsewhere, to step up and say things and amplify things, or not amplify, excuse me, to call things out when others can't, either because I'm more senior, or because I'm white, or because I'm older, or for whatever, or because my title on my signature block gives me the power to do so. And one of the things that I've been having a little bit of fun lately, been having a little fun lately with this idea, and I don't mean that as disrespectfully as it sounds, but not just to call it out and to suggest something, but to actually insist on something. right? That maybe for the first time in my own life as a woman, like I'm cruising into 50 and I feel like I'm now in a position to say, not, I think we should do this, or what do you think, or is this important, but to actually say things like, we cannot do this, right? This is something we have to address. This is something we have to fix. And even to appeal, this is going to be a PR issue. Like, forget what's right in this situation. Like, this organization, this group, this team, we can't be okay with this. This is going to play incredibly badly. And that sort of, that feels really good to sort of be at a phase, to be at a phase of career where I feel able to do that. Maybe I should have been doing it a long time ago, but I will stop there. I will say sort of, I wasn't going to stop there. I'll say as my last thing, I mentioned earlier, a lot of what happens for me is I look back on me 10 years ago or 15 years ago, and I'm pretty horrified, and I cling pretty strongly to this idea of when you know better, do better. That was Maya Angelou. I'm sure everybody knows. And so I would also just encourage anyone who's watching this or in our audience, we're going to make mistakes. I'm super self-conscious and anxious about like messing it up and offending people. As you know better, do better, and do what you can in the meantime. Any other last minute thoughts or comments from this wonderful panel? Thank you all for sharing your time, your talent, your knowledge, your candor, your help. To those who attended today and who will be watching this, I hope in the future, thank you for caring enough about this to join us. And have a great rest of your day.
Yes, and I'd like to just quickly pop in and remind everyone who's joining us, if you are not yet an ADAA member, we invite you to view the many benefits that we have to offer, including wonderful webinars such as this. And on behalf of ADAA and our panelists, I want to thank everyone for joining us today. And panelists, thank you for such a wonderful conversation.
Thank you.
Everyone have a great day. Thank you so much.
Thanks, everyone. I have to hop off quickly, but it was good to see everyone.
It was great.
Great to see you guys.
Bye.